Eastern and Southern Africa region has made remarkable progress in the AIDS response. Between 2005 and 2013, the number of new HIV infections declined by 32% in the region. Most countries in the region have rapidly progressed towards elimination of mother-to-child transmission of HIV and unprecedented progress on treatment. However, challenges remain. In 2013, about half, 1.1 of 2.1 million, of new HIV infections globally occurred in the Eastern and Southern Africa region. The 2014 UN AIDS Gap report identifies 12 populations that have been left behind by the AIDS response. These populations bear a disproportionate burden of HIV and significantly contribute to the number of new HIV infections. Access to HIV prevention, treatment, and care services for these populations is extremely low and is attributed to a combination of political, social, legal, and programming barriers. The UNAIDS Regional Support Team for Eastern and Southern Africa, with 29 partners, convened a regional consultation with sex workers, gay men, and other men who have sex with men, transgender people, and people who inject drugs. During the consultation entitled "Close the Gap, Leave No One Behind," more than 100 representatives of people left behind from 18 countries discussed the gaps on strategic information, access to HIV prevention and treatment services, and HIV-related stigma for people left behind.
The UNAIDS contribution to close the gap. First, we show the evidence. We provide and we try to compile the information about the gaps that shows very clear that we can go to the end of AIDS, but we need to mind the gaps. But above all, we help and we support the communities, men have sex with men, sex workers, transgenders, people that inject in drugs, and the other vulnerable populations to come in front of the response. The best help that UNAIDS can do towards the end of AIDS is making sure that the most vulnerable are taking the lead on the journey to end AIDS.
One of the primary objectives is to provide space for the communities. Then we also wanted to make sure that there's a south-to-south learning happening between the communities. So this is also an opportunity for us to review the current evidence that is available for the Southern and Eastern Africa region.
Well, we have the overall objectives that are set up for the meeting, and one of them is basically to come up with like a results framework or a strategic framework to continue to work with these key populations over the next 5 years, because it's actually the next 5 years that are crucial in closing the gap if we really want to reach the end of AIDS.
I'm expecting, in my opinion, a small organization like ours will be learn more how to reallocate their resources into the area that needed the most.
So I really expected coming and learning from best practice of other countries and how other countries have made it.
Whenever we talk about key populations, we tend to look at what is only around us and what we only think is around us, and we forget about those people that are really vulnerable.
The main gap for me will be information or understanding. For example, in Botswana, it has always been the law that we had that kind of sidelined the LGBT community was that you cannot have sex against the order of nature. But then people, even service providers, kind of use that to deny services to other people.
Last year, I enrolled in University of Swaziland. Every time we wrote tests and exams, my marks would just gradually decline every time. So I think it was the fact that I was a transgender, because all my life I have never gotten such bad results. I was studying like nobody's business, but that was unfair for them to do that to me. So I had to drop out of university. That's an experience that I'll never forget.
Myself, I went to a hospital and I wanted to be checked, in my rectum, because I just felt that discomfort. Then the sister who helped me asked me, why should I check it out? Then I had to tell her that I am a trans woman, so I get penetration through the rectum. And she had to call everyone or to come and see what I was saying, and people were laughing, some were just watching through the window. So having that stigmatization, which I just felt, I then said I won't go back to that hospital. It will take me more years to get my health requirements to be ahead in Zimbabwe, because the system don't even understand about where I'm coming from, because they will judge you instead of helping you.
How do we then begin to merge all of the sites that represent key population in being able to access these services that are meant to provide for general health care as well as HIV/AIDS prevention and care services?
We have such a big problem with HIV. It affects everybody. And what we need to do is to suspend our moral judgments. We've got a common problem to deal with, and to blame people or to stigmatize people, it doesn't help anybody, and we all suffer from it in the end. And the most important thing is sex workers, men who have sex with men, drug users, these are our sons and daughters, and we need to suspend our moral judgments and do what is right to make sure that they are full citizens, because that's the only way we will win this fight against HIV.
The theme of this consultation is Close the Gap, Leave No One Behind. It actually comes from our UNAIDS regional report, which was showing that in our region, actually even globally, there are some 12 populations that are left behind. But now at this consultation, we are talking about the 4. We feel that these are the populations that are usually left behind in any one country, because people they are controversial. People don't want to address them. And that's why we have called the very people who represent those populations to say, come, let's sit down and see what we can do at country level to ensure that you are not left behind in the AIDS response.
For us to close the gap, we need to, in addition to stepping up prevention efforts, in addition to stepping up treatment efforts, in addition to the conversations that are happening around improving policies and laws. My experience across Africa is that cultural institutions and religious institutions are critical in the national responses for key populations.
The law enforcers in South Sudan are people who have very low level of education. At times it's very difficult to understand some of these things that are happening, especially with key population. So we really need to have a lot of education targeting the law enforcers, and also do a lot of advocacy work, especially with people working in a key government position, so that at least they get to understand that key population in South Sudan is also part of the community that we need to embrace and work with them.
What needs to be done differently, and as it relates to communities, is to create more awareness.
On behalf of UNAIDS, I would say we are with you. We will keep on supporting you. A lot more needs to be done, but together with all the other partners, and especially with you, the community themselves, we can do it.
This consultation is new, fresh, and informative.
I would say it was very successful.
It's a necessity. It's necessary.
We have never seen big organizations standing for the LGBTI community, so this is historic.
It is actually good for key populations to having such platforms actually from the corners of the world to also brainstorm the accessing of the universal healthcare services and also the justice system at the same time, so that we can voice in a one voice.
The end of this epidemic depends basically on you. There are obstacles, there are difficulties, that's why we have gaps. But what we can gain, the historical achievement of ending AIDS, is bigger than any difficulty that we can face. Be brave and push forward.
Join the conversation using hashtag Leaving No One Behind.
Close the gap. Joining the conversation using the hashtag Leave No One Behind.